So when someone is struggling with both their mental health and their substance use, where are they supposed to turn for help? Well, way too often, the answer is nowhere. Today, we're going to unpack exactly why that happens and explore a whole new way of thinking about this double bind, all based on a really practical guide for healthcare teams.
And look, this isn't just some abstract theoretical problem. This is a real human crisis happening every single day. As this quote from Graham White at University Hospital's Dorset points out, people are literally falling through the cracks between two completely separate services. And it often happens right when they're at their most vulnerable. That desperation he talks about, it's real. It's what happens when our systems just aren't designed for the people they're supposed to be serving.
And I want to be crystal clear here, this is not some small niche issue. I mean, just look at these numbers. The overlap is absolutely staggering. A full 85% of people in alcohol services and 75% in drug services also have a mental health issue. And if you flip that, almost half the people in mental health services are also dealing with substance use. This isn't the exception. For the vast majority of people, this is the rule.
So when faced with all this complexity, the first thing services often do is ask, okay, which one is the primary problem? Is it the mental illness or is it the addiction? It's the default question. But what if that's the wrong question entirely? What if we've been looking at this whole thing backwards? You see, instead of getting stuck in that chicken or the egg debate, a much more useful question is, how are these two things related? The guide we're looking at today lays out 4 really common patterns that help us understand the complex dance between mental illness and substance use. Let's dive into the first one.
All right, pattern number 1 is what you could call substance-induced. This is pretty straightforward. It's when the substance itself is directly causing or triggering psychiatric symptoms. Think about how high-potency cannabis can sometimes trigger psychosis, or how withdrawing from alcohol can cause just crippling anxiety. Recognizing this is huge because in these cases, the symptoms might actually vanish completely once the substance is out of the picture.
Okay, now let's look at the flip side of that coin. In our second pattern, the mental illness actually comes first, and the substance use is a way of coping. You'll often hear this called self-medication. Someone might use alcohol to try and quiet down overwhelming anxiety, or maybe use stimulants to find a bit of focus that their depression has stolen from them. The substance here isn't the root problem, it's a solution. A temporary and pretty damaging one, for sure, but a solution to an unbearable feeling nonetheless. Now this third pattern, this is where things get really interesting. In this case, neither the mental illness nor the substance use is causing the other one. Instead, they're both growing from the same shared root, like a common vulnerability. And this slide right here gets to the absolute heart of the matter for so many people. We're talking about things like trauma and adverse childhood experiences, social factors like poverty and isolation, or even neurodevelopmental conditions like ADHD or autism. These things can create a vulnerability that can then show up as both a mental health condition and problematic substance use. It's why you can't just treat one branch without understanding the trunk it grew from.
And the fourth and final pattern is a trap that is just all too easy to fall into, the vicious cycle. It's like a feedback loop from hell, where each problem just makes the other one worse. Depression leads to drinking to numb the pain, but that drinking only deepens the depression, which of course leads to more drinking. It's a downward spiral that can feel almost impossible to break out of.
Okay, so we have this new framework, we have these 4 patterns, we get the complexity, so what now? What do we actually do with that information? Well, the guide argues for a really fundamental shift in our mindset, moving away from judgment and toward genuine curiosity. And believe it or not, that entire shift can start with this one simple but incredibly powerful question. Instead of asking, why are you using, which immediately puts someone on the defensive, asking, what does the substance do for you, opens up a totally different kind of conversation. It might reveal that they're using it to cope with trauma or to manage the sensory overload of a crowded room. It's a total game changer.
And that one question is really a gateway to what's called a motivational approach. The moves here are pretty simple but so effective. You start by expressing empathy to build trust. You roll with resistance, meaning you don't argue when someone gets defensive. You gently help them see the gap, the discrepancy between where they are now and where they actually want to be. And you support their self-efficacy, which is really just a fancy way of saying you become their cheerleader, helping them believe that they do have the power to change. Now, on a bigger, system-wide level, the solution is something called the no wrong door principle. What this means is, if someone shows up at a mental health clinic, but they also have a substance use issue, that clinic doesn't just turn them away and say, sorry, wrong department. No, they take responsibility for the whole person. It's about ending the bureaucratic runaround and meeting people where they're at.
So what does all this look like for the people on the front lines, day in and day out? The guide boils it all down into a few key principles that can make a massive difference in people's lives.
First, always start by asking about the function of the substance. When you're in a crisis situation, don't get obsessed with finding the perfect diagnosis. Just focus on helping the person in front of you. It's also crucial to understand that withdrawal isn't just a bit of anxiety. It's a serious, potentially fatal medical emergency. Adopt a harm reduction approach, which is all about keeping people safe, even if they're not ready to stop using. And maybe most importantly, remember that a consistent, non-judgmental relationship can be the most powerful treatment there is.
When you really get down to it, this whole explainer boils down to one fundamental shift in our focus. We have to stop playing detective and start being human. The moment we stop asking, what's wrong with you, and start asking, what happened to you, well, that's when a whole new world of connection, compassion, and real healing opens up.
And that leaves us with one final thought to chew on. This approach, this simple shift from judgment to curiosity, can completely transform one of the most complex and stigmatized problems in healthcare. So I'm going to leave you with a little challenge. Think about just one conversation you can have this week where you choose curiosity over judgment. It could be with anyone, a patient, a colleague, a family member. You might be really surprised by what you discover.